Hi there. Good morning, good afternoon, good evening. I hope participants have enjoyed the 2023 Innovation Exchange and Partners Summit hosted by the Solutions for Youth Employment program at the World Bank. It is my pleasure to moderate this session today that is focusing on from algorithms to opportunities, looking at harnessing innovation for youth employment throughout the world. First up today, we will have Kate Tulenko, who is CEO, the founder and CEO of Corvus Health, a firm that helps health systems and governments develop, manage, and retrain an optimized workforce. Kate is also the founder and CEO of Appleseed Education, an edtech platform addressing the global health worker shortage. She was previously with the World Bank. She's been recognized for her contributions in global health by being named one of the 50 women in global health security and one of the 300 women leaders in global health. Kate, it is my pleasure to welcome you today, and we look forward to hearing from you about using EdTech to address the health workforce shortage in Africa. Over to you.
Great, thank you so much, and it's a pleasure to be with all of you today. And as you know, Africa's youth will make or break the continent. Almost 60% of the African population is under the age of 25. 1 in 4 of them are not in education or training or employment. And Africa will need to absorb 122 million young people into the job market over the next 10 years. So that's 12 million a year, and some estimates go up to 18 million a year. And also at the same time that we're seeing this incredible labor abundance in Africa, we're seeing a labor shortage in high-income countries. Most of them are below replacement fertility rate, and with the aging of their populations, they literally need tens of millions of new workers and new skilled workers. But unfortunately, at the same time, due to the economic crisis that's going on globally, many African countries are reducing their support to higher education. So there's a real opportunity and a crisis. And so there we go. Both Africa and high-income countries need millions of new health workers. Vacancy rates in Africa for nurses range from 30 to 55%. These are funded positions that are vacant. And just to give example of vacancies in high-income countries, the NHS currently has over 100,000 vacancies. The U.S. has over 1 million vacancies. Germany has 12% vacancy rates for nurses in ICUs, 6% in other wards. So the WHO actually estimates there's an 18 million health worker shortage. And this understaffing, this shortage of health workers, it not only affects people's health, and from a humanitarian view, their well-being, but it affects economies because they can't grow well if people aren't healthy. And it also affects the sector from a business point of view, that the private health companies can't make money and can't grow if they don't have the health workers to do the work. And even though African health professional schools would like to meet this demand regionally and globally for skilled health workers, they're not able to. Every year, they turn away tens of thousands of qualified applicants because they don't have the capacity to train them. Most African health professional schools are less than 20 years old. They're founder operated. They don't have access to professional management. They don't have access to capital to expand. They don't have online learning, surprisingly, even post-COVID. And there's also a faculty shortage, particularly in nursing, which makes it a challenge to scale up. And many schools, particularly allied health professional schools, have dropout rates of 60% or higher, 60% or higher. This is a triple loss because the school loses out on the tuition, the student loses out on a lifetime career with incredible opportunity for advancement. The communities lose out on not getting a health worker. Next slide. And so in order to address this crisis and meet the opportunity for training young Africans to be skilled health workers, we started Appleseed Education. It's an edtech platform that's going to raise all boats. It's going to help all 5,000 health professional schools in Africa expand and improve. And we do this by helping them scale existing programs, start new programs, improve the quality of the existing programs, and also improve the mobility of their health workers so that the certificates or the licenses they receive are either regionally or globally recognized. Next slide. So we offer our scaled services. And just to give the example, the three main services that we provide, the first is a platform services available via the internet. Schools pay an annual fee and they get annual school assessments with goal planning of what exactly they need to do to reach their goal of expanding, improving, or adding new programs. They can also subscribe to centralized services. This is basically a back office for health professional schools. Many of the schools we most want to expand are in more rural areas where they're unable to hire the professors they need, or even just the back office staff, the accounting and procurement staff that they need. Schools will have better insight than anybody into which schools are high quality, what schools need to improve. And I also want to mention another factor of our platform services is we do group procurement, so that everything they buy, from simulation mannequins to computers to books or digital software, will be how we could help in some of Africa's unique challenges. So if we could have the next slide. Yes. Okay. We've all seen just the terrible photos of terrible images of refugees and asylum seekers from North Africa on very rickety boats trying to get to Europe and literally being pushed away and drowning in the ocean. We know that Africa has 30 million refugees, 1/3 of all the world's refugees. The typical refugee spends 10 to 15 years in a refugee camp, which when you think about it is more than long enough to go to medical school. As I mentioned, 125,000 people immigrate or attempt to immigrate to Europe every year via the Mediterranean. But on the positive side, 70% of refugees have phones or access to phones, and 90% of them have access to 2 or 3G networks, which would enable them to get online. So we're working with many of the schools to see how we can offer online learning to youth in refugee camps in Africa. There are literally dozens of different types of non-clinical jobs in healthcare that can be trained completely online. This is IT, data analysis, billing, coding, social work, hospital engineering, farm techs. And then the group that are doing clinical work and need to have clinical experience, pretty much every refugee camp has a clinic on site, and most of them either have a hospital on site or a hospital right outside of the camp. So there's ample access to clinical sites, and these are sites that other students are not rotating in, so the opportunity is there. And of course, once they complete their degree, we can help match them with jobs, whether locally, regionally, or internationally. So really changing them from rejected to recruited.
Thank you very much, Kate. That was really interesting to hear. I wish it was possible to train everyone immediately. Such an important area of work. Next, it is my pleasure to welcome and to introduce you to Anubhav Arora. He is the co-executive director of shared programs at Noura Health. Noura Health is a non-profit organization that works with public health care systems in India, Bangladesh, and Indonesia to train patient families on life-saving skills. Anubhav joined Noura Health as its very first hire 10 years ago in 2013, and in his current role is helping develop programs in new geographies and conditions with a specific focus on digital platforms. He was previously a health systems researcher at the Massachusetts Institute of Technology, where he delved into futuristic digital healthcare models, and has also been a legislative fellow with the Indian Parliament. Anubhav is going to speak with us today and share with us his experiences at Noura Health about remotely empowering caregivers in India, Bangladesh, and Indonesia. Anubhav, over to you.
Thanks so much, Marilise. Really glad to be here and to join from India. Next slide. Just to quickly describe the problem that we are trying to solve at Noura Health. So on the right, we see a typical open ward in South Asia, which is full of patients. but also more than patients full of their family members. On the top left, we see a figure which contrasts that abundance. So there is a shortage of 2.5 million healthcare workers in India alone, due to which the healthcare staff gets to only spend a few minutes with the typical patient. What this results in, excuse me, the previous slide. What this results in, the patient and the family leaves the facility unprepared, full of anxiety, and they suffer. A wound gets infected, a warning sign might get missed. Next slide. At Noora, we fundamentally believe in the role that families can play in healthcare or in caregiving. We've seen that by training and supporting patients and families, we can save lives. It all starts by us identifying actionable skills, priority behaviors that can increase healthcare outcomes, and by developing engaging materials and tools to translate those practices. We then we work with healthcare systems, we train the healthcare staff in those healthcare systems. We train them on running group sessions within the healthcare facilities, and in integrating the program as a structured program. At the end of the session, a patient and their family gets an opportunity to subscribe to a phone-based messaging service that continues to reinforce the messages at home. Next slide. So digging into the phone-based health messaging service quickly, this is the patient-facing digital product that we are building. It's multimodal, so the patient can access material via pre-recorded voice calls, via WhatsApp, or via a live chat or a live call system. We have an in-house team of nurses and doctors that are able to respond to user questions live. It is multi-condition. So we have content messages across maternal and child health, across non-communicable diseases, cardiology, oncology conditions. We are also testing different messaging styles, richer media to engage with the users better. Next slide. And the second digital product that we are building is healthcare worker facing. So with this tool, we are trying to engage and support our frontline trainers better. And some of the use cases we are testing is how to streamline data collection, how to give the trainers valuable insights, actionable insights to further motivate them, how to give them access to e-learning platforms, digital content. We are also A/B testing a couple of tools for this platform. One is an offline first application, and the other is a WhatsApp-based chatbot workflow. Next slide. And so what are we focusing on currently with the two digital products? One is improving engagement, further improving engagement with our users through, as I mentioned, A/B testing different messaging styles, integrating a learning management system in our healthcare worker tool, building scalable workflows, especially our response system on WhatsApp. So being able to respond to user questions at scale. Today we respond to about 500 questions per day, and that number is only growing. We are also putting more focus on higher risk patients and increasing the dosing of the messages and the intervention accordingly. And also building centralized dashboards that enable us to do experimentation in a more effective manner, as well as doing specific evaluations on our messaging platform and the healthcare worker facing tool. Yeah, happy to answer any questions.
Anubhav, that was it's so interesting to learn about the solution that you've developed. Often we assume that caregivers are automatically experts in how to do their jobs well. And I think you've clearly shown us how there are some innovative solutions that can help in that regard. Our next speaker today is Mercy Simuyu. She is Dimagi's Director of Frontline Programs at ComCare Connect. Mercy holds a public policy degree from Seattle University, as well as a public health degree from Tulane University, centered on health systems management. Leveraging her work experience that span multiple continents and diverse sectors, but always focusing on community impact, Mercy's current role focuses on driving forward ComCare Connect's vision for building and delivering technology services directly to frontline workers, especially with digital learning. Mercy's extensive experience with African health systems, development partners, and community health efforts that lean on technology has allowed her to tap into how technology has supported opportunities for youth within health, agriculture, and the finance spaces, and in parallel, sustainably push for positive health-seeking behavior and overall impact. Mercy, over to you. We look forward to hearing from you about data-based solutions to inform frontline health workers.
Thank you, Mary-Lise. It's a pleasure to be here, and it was a pleasure to listen to both Kate and Aburav. I work with Dimagi, and Dimagi has been around for about 20 years. And I'm excited to talk more about ComCare Connect. Next slide, please. Dimagi is a global social enterprise. It's been around, like I've said, for 20 years, and most notably well known for deploying ComCare, which is one of the most widely used platforms that enables frontline workers. It's been used across multiple sectors to deliver services at the frontline. Our vision as Dimagi is to have a world where all people have access to the services that they need to thrive. And this is very key, especially within health. Next slide, please. Now, with the vast experience that we have, I think Dimagi currently reaches over 150,000 frontline workers who are working in various countries across the globe. And what we've noted in a lot of the global spaces where we are, Africa and Asia, there's the opportunity for youth to be empowered to work as frontline workers for delivery of health services. I think we all recognize that frontline workers have been able to tap, even more recently due to COVID, into digitally supported capabilities, because the aim is for them to deliver more services and unlock additional impact. So we've seen that youth have the opportunity. For example, in Kenya, you can find that in urban areas, urban settlements, you might find that the health worker cadres are mostly made up of youth. Because literacy sometimes is an issue when expecting youth to access formal trainings. You can find that some programs have waived literacy prerequisites. So within the health sector, within the agricultural sector, working as an extension worker might not really require you to have a specific kind of degree. You can come in at the lower level cadres and work your way up. Because of this access, what we've seen is that there's opportunity for performance-based incentives to help support that upward spiral into stronger careers for the youth who are working as volunteers to start, and then leveraging that experience to become more official frontline workers. Studies have shown us that age, gender, and education seemingly have no effect on a frontline worker's ability to classify pneumonia, for example, and provide treatment accordingly. But all this is based on the amount of training that they're able to access. Next slide, please. Now, when it comes to ComCare Connect is built upon ComCare's platform, and it's divided into 4 verticals, where Learn, where the users are able to receive training through a digital training platform. It can be either mobile, web-based, or even SMS, even as far as chatbots, depending on the context and depending on what the user can access. The second vertical is Deliver. After training, they're able to deliver the service at the household level with job aids in hand with the phones that they have, leveraging ComCare in that way. The third vertical is verification. Once services are delivered, Dimagi is able to verify that it's been delivered, and we couple this with in-person verification from either health supervisors or other people, stakeholders within the ecosystem in which the frontline worker is working. And then the final vertical is pay, something that I know within the health sector, a lot of people have been discussing how to pay community health volunteers. And this is very key, especially for youth who are looking for employment. You want them to volunteer as health workers, but they also need to earn a living. So these four verticals work together to build out ComCare Connect and that vision of helping extend ComCare forward. Next slide, please. Now, diving a little bit into the Learn vertical, we provide an integrated learning experience. You are able to sign in and go to the digital learning platform. You can access audios, you can access visuals, videos, and you can use this as a reference even as you're delivering services. The second portion is being able to verify the competence that you've understood what you've been taught and you're ready to deliver it. So we do put in tests so that people, the users, can demonstrate their competence. And as I said, we also work with in-person and other remote human in testing that can be included to verify and demonstrate competence. Then the final part of the Learn vertical is the certification. Once you learn, you're able to get certified, and this just helps you build your career within ComCare Connect. Next. Now, stepping back a little bit, Dimagi's experience overall with technology for youth, I think what we've learned is that there's a hunger for digital platforms, especially in certain settings. Being able to access phones, whether they have a 2G or 3G network, like Kate mentioned, is very key. You should be able to use human-centered design approaches to reach the youth where they are. So because ComCare has case management features, has job aids and targeted follow-up, as well as the ability to provide linkages to employers, we are able to set it up in a way that anybody, not just youth, is able to leverage this. And this is very appealing to governments who are looking to expand their health workforce, who are looking to sort of strengthen the bottom of the pyramid, folks at the household level. And it also coincides with this need among youth to really do impactful work. One thing we also have is the predictive analytics. So we're able to look at which youth are at high risk for dropout and what then do the stakeholders need to be able to keep them involved. I think, next slide, please. And I think at the end of it all, for ComCare Connect, what we hope to do is sort of shift the conversation around volunteerism. And so by providing a platform where you learn, you deliver, we verify, and we pay, we're sort of helping the youth tap into sectors that were previously inaccessible due to levels of education. Thank you.
Thanks very much, Mercy. Before I introduce our last speaker, Samuel, I wanted to mention that we have a couple of questions from the audience. We'll probably only be able to speak to one of those questions, but I wanted to put it out there for the speakers so that as Samuel shared with us his insights, you can think about the question and have some answers ready. The question that's been asked is, what are some of the ways in which governments can work with the private sector to strengthen local health systems while also creating new opportunities for the youth? I think it's very much the topic that we've been learning and sharing about today. So just to keep that in mind is the question that's been asked. With that, it's my pleasure to introduce Samuel Joy Cherian. He's the founder and CEO of Hunter. He is a former senior digital consultant for the Emirates Group and also an advisor to the Solutions for Youth Employment Young Advisory Group at the World Bank. He started Hunter out of the frustration of the legacy hiring system that is used by enterprises in the Middle East. He's an alumni of the Techstars New York City Accelerator. Just a little bit about Hunter. It is a migrant worker marketplace, very much along the lines of what Kate was describing earlier today, providing opportunities not just for the youth, but for migrant youth. It is a marketplace that helps enterprises, companies with 3,000 or more employees connect with government and training partners to source, manage, and onboard a job-ready blue-collar and healthcare workforce. Their platform saves enterprises thousands of dollars by enabling candidates to be trained and onboarded in under 30 days, compared to the legacy systems that can take 2 to 3 months. Samuel, over to you. We're very keen to hear from you about what can be done to match migrant youth to job opportunities. Over to you.
Thank you so much, and it's a pleasure to be here with you today. My name is Samuel, and I'm the co-founder and CEO of Hunter. Next slide, please. Yes, so what we created is a result of employment technology, government coordination, and a culmination of years of experience to build trust and transparency in the hiring system. So what you see on the screen is a model where large enterprises connect with service providers such as government agencies, nonprofit and for-profit organizations to gain access to thousands of frontline workers. In fact, we started as a two-sided marketplace, and we found out that that didn't really work, and there was a need for a third-sided player, and so that is a service provider, and we brought that particular player in, and we've seen how government plays a huge role, training organization plays a huge role in that piece, and I'll dig more into that. Next slide, please. There's a video which I'd like to show. Yeah.
Trusted service providers. These are vetted government, training organizations, nonprofits, and for-profit organizations with an ethical supply chain in large sources of blue-collar workers. These candidates create a profile on Hunter and verify their identity with their passport and phone number and apply for open jobs on the platform. Enterprise recruiters leverage our intuitive user experience to shortlist relevant candidates and set up interviews. These service providers upload all the necessary paperwork on our platform and provide basic training to these candidates while they wait for their visa.
So the atomic value over here is a job. So we start by working backwards from a role that we want to fill, and we want to source people into these roles from different countries in Asia and Africa based on their potential and plug them in with our training partners and the content we have developed with the clients. So the pre-selected ones will go to the next stage, and all their documents are uploaded onto the software. And once the enterprise selects them, the offer letter is issued, the visa is issued in 3 working days, and candidates are brought into the country in 30 days. In fact, we have clients, bringing the candidates in 7 working days, which usually takes 2 to 3 months. So we have a very lean team working with various ecosystem partners to bring this mission to life. And I want to probably mention 2 examples of the power of technology and government coordination to match job with opportunities. Next slide, please. Oh, sorry, it's the same slide. Yes. So the challenge was that the frontline workers in the UAE face the threat of overstaying fines, and many were here without employment opportunities. So the solution was that we partnered with the Sri Lankan embassy to connect with their database to our app. So by leveraging our innovative matching technology, we skillfully match their skills with job openings in the UAE market. And as a result, within 1 week, hundreds of frontline workers found employment opportunities, avoiding overstaying fines, and being able to send money back home to their families. Now, the second example, picture this. The need to recruit many frontline workers from Malawi, a crazy bureaucracy for obtaining essential documents, and also a traditional recruitment process that was time-consuming and labor-intensive. So the client reached out to us. So the first step that we did was we partnered with the former president of Malawi and got the financial institutions in Malawi to provide microloans specifically tailored for the candidates. So these microloans covered the cost of securing passports and other official documents. And our digital platform allowed for the rapid processing of the documents, eliminating need of any physical paperwork, and the visas were issued through the app as well, making the whole process streamlined. So in conclusion, we see our product as an ecosystem where training partners, government partners, microloan providers plug into our system and create solutions and opportunities for individuals and enterprises alike. So it's all about empowering people, facilitating economic growth, and ultimately building a better future. Next slide, please. And as we move forward, we are committed to expanding our reach and impact, connecting even more workers with job opportunities and helping enterprise thrive in this rapidly changing world. We believe that through technology, innovation, and collaboration, we see a brighter future for all. Thank you for this opportunity.
Thank you very much. As we close the session today, we have unfortunately not had a chance to answer the question. I think the involvement of the private sector is critically important, and you're welcome to connect with the speakers and also with the Solutions for Youth Employment program, with Namita and the team, to learn more about how the private sector can be involved. And also, Anubhav, there was a question for you around whether the youth are interested in caregiving opportunities and training in this regard. So yeah, let me close by thanking everybody, by thanking everyone who was online, and hoping that you'll enjoy. I believe there's one more session to follow after this one. So we hope you enjoyed the last session of the day, and we thank you very much. It was so interesting to hear from everyone that there are solutions for youth employment when we think about innovation and technology, and that we can build on and expand on what these innovators are doing in this space. Thank you very much for all your hard work, and we look forward to hearing more and to following your path to success. Thanks very much to everyone.